When people have surgery done, it's not for other people. It's for themselves, so then when they look at themselves in the mirror, they're like, you know what, I feel good. We all want to be confident at every age. Just because you're 50 doesn't mean you need to disappear and be invisible. Kris Jenner she looks amazing, but she looks very different because she had quite a lot probably done at the same time. Slightly different, whereas Brad Pitt, and you just know that he looks better, but you can't really put your finger on it. He still has that hooded look, even if he did a little blepharoplasty. It's not pulled, the lips don't look stretched. The lips, I think, are a big giveaway sometimes.
What about this whole talk about SPF, how bad it is, and all the chemicals we're putting on?
There's no such thing as natural skincare. Anything that lives past a week in skincare has chemicals in it. You know, water is a chemical. I find it's a very big misnomer because everything has a chemical in it. And if it didn't, we wouldn't be using it.
Hi, and welcome to Driven Women, brought to you by Cash and Rocket. I'm Julie Brangstrup, and this is a space where horsepower meet ambition, where style, energy, and a little bit of a billion fuel every conversation.
Hi, and welcome to Driven Women. Today's interview is with Dr. Maryam Zamani, and there's a lot to be known here, from being a plastic surgery, focusing on the whole face, to building a global brand and being a mother of two and living here in London. So thank you so much for coming.
Thank you so much for having me.
In our gorgeous little
I know, this is adorable. I love it.
At the Peninsula London.
It's fabulous.
So, explain to me, how did it all start? I mean, you know, specializing surgeon in the US, and then take us back to the beginning. And
back to the beginning. Well, my mom and dad are both doctors, and I'm the eldest of four. Always knew I was destined to go down the doctor route. And actually, I started liking plastic surgery because of a trip that I took to Thailand. So I went with Operation Smile for 3 weeks to a small little place called Nakhon Si Thammarat, and we operated on cleft lips and palates. I say we, but actually it was the plastic surgeons. I was like a measly medical student at the time. And it was really awe-inspiring. You know, these people walked, some of them for days, to have surgery, and they had some really major defects and issues, some young, some old. Most of them didn't speak any English whatsoever. And I was just in awe of the doctors and the nurses who had given their time to this cause. And I came back and I was like, oh my God, I love this. And also, it was, you know, back then I was a student, so I never got to really do any surgery. And there they would let me suture up some of the things for the closures. And I just thought, this is what I'm destined to do. Then fast forward, I was deciding which subspecialty I wanted to do, and you can go into plastics in 3 ways. One is to do, at the time, general surgery, which is the whole body. One was ENT, ear, nose, throat, and the other one was through eyes. And one of my friends was like, you know, you're so meticulous and you're so neat. Look at all 3 of them before you decide, and I think you're going to go through the eye section. And
do you test all 3 of them?
Well, you can, yes. In medical school, you have like, rotation. So you have like 3 months in different categories, and you can choose some of them. There's some basics you have to do, but you got to choose.
Okay.
I didn't like anything on the body. I was like, oh my God, this is not for me. And then the neck, I saw, depending on where you're practicing and you're learning, I was in a place that had a lot of cancer, and so I was seeing a lot of neck cancer, and it was making me feel a little bit down. It's a very hard specialty to be in anything cancer related. You have to really have, in my opinion, a very strong constitution to help those people, because it's just such a heavy burden I felt on myself, even as a student. Yeah. And then the eyes, I was like, this is so fun. Everybody leaves, they come back, they're happy. And I loved that feeling. And so that's sort of,
awake.
Yeah, no. So I went down that route, and I was like, you know what, this is what I want to do. And so that's how I decided on that, after not even knowing it was even a possibility. And when I moved here, I wasn't working. I wasn't allowed to work. And I Googled back in the early days of the net, actually kind of crazy. And I found this woman, and I didn't know it at the time, but she was a huge person in the field of oculoplastics, which is what I do. And for some reason, she took a liking to me, and she helped me with my, paperwork. She sponsored my visa. And she helped me also with all the registration to become board certified here. I grow a great deal to her. So, and that's really where it all started. And the other stuff happened by chance, because in the US I didn't have access to a lot of the things. It was the early days of injectables. But in the NHS, working with her, we were using fillers, hyaluronic acid fillers and threads and all of these things.
You were?
Yes, we were.
At that time?
But we were using them for people who had multiple surgeries from a tumor or an accident, and they maybe had 10 15 surgeries, and they just wanted to do something to look a little bit better.
Yeah.
And on the NHS, you actually can and could at the time do all of these things. And I was like, wow, there's so much to do before, you know, having to go have a mid facelift or, you know, have another surgery. And that's
We're
what
so
got
coming
me.
back on that subject.
I know,
Yeah.
we will. I know. So that was actually, it was super fun. And I decided I need to learn a little bit about dermatology. So I did dermatology with Cardiff University. And when I decided to go out on my own, I wanted to combine everything. I wanted to do the surgical and the non-surgical, had my kids in between, developed terrible melasma. And MZ Skin was really out of the necessity for myself to find something that was efficacious, but also felt like lovely to put on my skin, to fuse the two. Had no idea that I was starting a skincare brand at the time. I mean, I was doing it for myself essentially. And
here
then
we are.
Here we are 9 years later.
Global
Oh my
skincare
gosh, well,
brand.
it's been a lot of work. It's exciting.
And I am going to use it today.
I brought you some placenta products. I'm excited for you to try.
Placenta product.
Yes, they're vegan. They're made in a lab. They're biomimetic, and they have growth factors. So I'm all about regenerative medicine in general and harnessing what we have in our own bodies and trying to get our own bodies to work harder. So we have a lot of growth factors. We have a lot of peptides. We have amino acids. We have a lot of great things that work together to really kickstart and tell your skin to make more beautiful skin.
Okay.
So you have to tell me what you think.
What is your daily routine and you know that you every day you go through to have this beautiful skin?
You're so kind. Well, I mean, it's a lifestyle. You know, like everything, it's a lifestyle. I wake up. I have, like you, a very busy daily life. I don't have as many kids, but you know, I have other kids who I call in my office. But I wake up. I'm not like a 5 a.m. riser, like some of these amazing people who are like, yes, I wake up, I meditate, and then, you know, I have gratefulness for an hour. I wish I could do that, but I wake up. I do actually think of 3 things that I'm grateful for in the morning. And then I just check my phone to make sure there's no major issue that I have to deal with that I slept through for some reason. And then wake up, have breakfast with the kids, take my daughter to school, and then I go to my office. And I see patients half the day, which I love. Patient care is really something that I love operating. I love the relationships I have with my patients. I love the connection also that we have with one another. And I love the fact that I help women feel their best at every age. And then the afternoon, I'm basically with the skincare line most of the day. Then I go home, try and hang out with my teenage kids who don't really love me as much as they used to before.
I think we all go.
Yeah, I know. And then I have to exercise. So that's like my therapy.
You do that in the evening?
I do. I don't have the energy to do it in the morning, funny enough. Like, I can think in the morning, but actual physical energy, I also think I create a lot of energy during the day, and so it's my way of like releasing energy at the end of the day.
Yeah.
And then, you know, dinner, back to emails, maybe go out for a meal, like, you know, whatever it is, and then I sleep. I'm trying to prioritize sleep. So my skincare ritual is very simple. I think it's very important to keep it simple, otherwise in this crazy busy world, it's hard. I have a simple philosophy: reveal, enhance, protect. So nice cleanse so that you can have a beautiful foundation for all the things you're going to enhance your skin with. The enhancement for me is about having a clear palette. So like you have flawless skin, like you don't have pigmentation, you don't have redness, no pimples. Like that clarity of skin is actually what makes people feel more youthful. So for me, it's pigmentation. So I have ingredients that help with that, either vitamin C, retinol, combination of sometimes even prescriptive skincare. And then hydration, because as we get older, hydration is important, but I have a lot of these pro-aging ingredients in my products, so your skincare is working harder. So with the biomimicking placenta, with the eye creams, all of those things to really tell your skin to create more, you know, skin essentially. And I do it in the morning and night: cleanse, eye cream, serum, moisturizer, SPF, and then at nighttime I do the same thing, but just without the SPF.
And what about this whole talk about SPF, how bad it is, and all the chemicals we're putting on? I know, you know, but so I use it a lot.
Yes.
And now, you know,
You
my
worry.
sister and I had a discussion about it. She's like, Julie, you're putting on too much. There's definitely something bad about it.
So for pro-aging, it's 100%, like we know. I mean, it helps prevent pigmentation. It helps prevent the breakdown of collagen. UV damage, UVA and UVB actually does age your skin. So it's causing damage to your DNA of the skin, and you are going to have more fine lines and wrinkles. And we're going to, I mean, aging is a blessing, but we're all going to age. But you can accelerate your aging with those things. If you take a person who has lots of pigmentation on their skin and somebody who's clear-faced, the clear-faced person is going to look a decade younger, and that's without question 100% of the time. So we know that UV protection is very pro-aging, and if there's nothing else that you do in your life, that if you just use sun protection, that's very good. We also know that it helps prevent skin cancers, and so different skin types are more prone to having that. And if you're living in a climate where you have constant, sun exposure and you've gotten burned, well, you're going to cause more damage to your DNA and your skin. So, yes, we put chemicals on our face. There's no such thing as natural skincare. Anything that lives past a week in skincare has chemicals in it. Water is a chemical. So I find it's a very big misnomer, and it's almost like false advertising in my opinion, because everything has a chemical in it. And if it didn't, we wouldn't be using it. And also you're generally putting it on your face most days. I mean, most people don't live in just sun all the time to be putting SPF on their whole entire bodies.
Luckily we're here in London.
Yes,
so,
yes,
we're
we're cold. Well, and also we're covered most of the time. And we do need sun for vitamin D and all of those other things. But I think it's more marketing for the SPF. Okay. I think face, neck, chest, hands, if you're thinking about aging, if for no other reason vanity, it's very important. And of course for skin cancer.
Okay. And then how do you run this whole thing, do the surgery and being a mother? I mean, are there compromises within?
Of course. It's always a juggle, I mean, it's always
Where's
finding
your
the
biggest
time.
struggle?
The biggest is with my kids. I always feel like I'm, there's that guilt is always real. So I feel, I try to be there in the present, but I also need to, I'm also a little bit, I don't use OCD in a bad way, but I'm also I have a list of things, and I feel like if I don't get through that list, I actually can't sleep at night. So that juggle is constantly there, but I do try to be in the moment when I'm there. And actually the phone is the biggest difficulty, and the fact that everybody is accessible all the time and people are pinging you at all hours of the day and night. And it's not just on email, it's on WhatsApp, it's on LinkedIn, it's I have 3 different email addresses, and it's messaging in general, and then social media, I have a presence there. So I feel like everybody feels I'm accessible, and I feel the need to be able to write back to people. So I'm very quick at responding to people. It's one of those things. Yeah. It's ingrained in me. But I think the list helps, so I can prioritize what I need to do. Yeah. And I always try and keep an extra hour in the day for extra things, because there's always something extra. Yeah. Life is extra.
Yeah. And something comes in and changes the schedule. And so within your product range, what would be the hero product that you would pick out and say,
what's my favorite baby?
Yeah,
that's hard to say, but
I
think
you like all of them,
yeah, I do. So
the one where you're like, wow, this really.
I really love the eye cream that I put in here for you. Okay. So, as an oculoplastic surgeon, everybody complains about the area around their eye. And it is the first area to show aging, because you're smiling, you're chewing, you're blinking, you're emoting, everything happens around the eye. Yeah. And it's also the thinnest skin on the face. And the lines and wrinkles are real. Pigmentation is also real, because actually the places that are the hardest reaching for SPF are in the hairline, the ears, and no one puts SPF unless they think about it on their upper eyelids or even close to their lower eyelids, because they're worried about getting it into their eyes. So you see a lot of damage in that area first off. And so the placenta eye cream is, I think, a hero. It has amazing, my clinical trials are wonderful. It actually even helps to open the upper eyelid, which, to my knowledge, it's the only eye product that has been tested on the upper eyelid and has these sorts of results. And so, again, it has all the pro-aging.
I need to have it done.
Eventually, we all do. It's like gray hair. It happens to everybody.
That I have as well.
The joys.
Okay, so that's your
I think, I have a lot of really great eye products. I actually have another one too in here for you, the Microtox, which is good for fine lines and wrinkles, also filled with peptides and ingredients that kind of mimic, you can never get, neuromodulator like Botox or Dysport in a skincare product, but it has ingredients that help to relax some of the lines and wrinkles.
But are there any products out there that has kind of similar effect as
Well,
Botox?
that's sort of the microtoxins in there, but I prefer the placenta eye one over everything.
Okay.
But I gave you that too to try out, so you can try them.
And what about threads and
Good question. So a lot of people love
I tried
threads.
it and I literally could not see the difference. I mean,
Yes.
this was 5 years ago. Or
A lot of people say that, so that's a
have they
common.
changed? Have they become better?
So there are different ones, and obviously technique is really important.
Yeah.
But I kind of think it's a very invasive treatment for a non-invasive treatment.
Yeah.
And so in my thought is that if you're going to go that invasive, then maybe like a little nip or tuck is sort of better. There are some places that sometimes on the knees or on the arms you can actually have some improvement in collagen formation too, and a little bit of a lift that can be seen. But I don't
with
really,
threads?
yes, because there are some bigger ones that you can use for the body. But for the face, I've had to take out so many, some that were like poking out. Some of my plastic surgeon colleagues who do facelifts say that they can see them. Oftentimes it takes a lot longer for them to disappear than what we think. So, anything that you do immediately is going to show some effect, probably also from the swelling that you get from having a procedure done. I think that's a pass for me. Out of all the treatments, I've tried so much in my office. That's the only one I haven't done on myself. It's just not something, I feel like I'd go for a lower facelift before I do that.
Oh yeah, so let's go into that conversation.
A fun one.
So I'm very fascinated by.
Aren't we all?
I've got so many friends now that have had a facelift, and in most cases they look great. Some cases they don't look so great either. And obviously, if you are touching your face, and I'm all for everyone, go out and do whatever makes
No
you happy.
judgment.
I have, I'm up for trying anything, but your face has got to be someone that's good, but also, so there's half and then full.
So basically everybody is
Can we
getting
do it
kind
step by
of,
step?
we can. So you can have an upper facelift, which is brows, and
Right.
usually includes the upper eyelids. Then you have
Right,
a
so you go
lower,
up here.
well, there are different ways of doing it.
Right.
Most common of people, that want to have the most natural, it's usually done with an endoscope, so there are little incisions that are made here, or minimally invasive in terms of the size of the entry point. To get the lift, which is better. You could actually do it within the hairline, but then there's a big scar associated with that. So most people do it, with the small incisions. So that's an upper facelift. That's usually done when you do a whole facelift.
Okay.
A mid facelift is really when you do, the cheeks, and this is quite nice actually. Who wouldn't
I
love
like
that? Yeah, I love that too.
I'm ready for that
And then a
any day.
lower one is, the lower part. It's for the jowling that happens, to create a stronger jawline. And then
But aren't you
usually
doing
that
that while
affects
you're doing it?
with the whole facelift, yes. And then you can have a neck lift with it too. So a facelift usually has the scars like in front of the ear, behind the tragus, this little area, and a little bit in front of the lower part of the ear, and then it goes behind the ear. If you do the neck, sometimes there's another scar that's here. And most people now do what's called a deep plane facelift, which is using deeper layers of the face in order to have hopefully a longer lasting result, because it's not just moving the skin and some of the tissue associated with it. And then the thing is, the more natural it is when you do it in parts almost, because if you actually do this, no one's going to notice you've had, they might notice the scars early on, but no one's going to think you look different.
Yeah.
But if you do this and this and this all at the same time, sometimes you can be very dramatic, and it can sort of change, like the Kris Jenner look. She looks amazing, but she looks very different than what she looked like before, because she had quite a lot probably done at the same time. Still beautiful, but, slightly different. Whereas you look at someone
She
like...
looks like 20 years younger.
She looks amazing. She looks insane.
Yeah.
But you look at someone, like Brad Pitt, and you just know that he looks better, but you can't really put your finger on it, because he still has that hooded look, even if he did a little blepharoplasty. And, this is not something you notice because he looks like him. It's not pulled, the lips don't look stretched.
Yeah.
The lips, I think, are a big giveaway sometimes.
Yeah, That's the, you know, where they're smiling.
Yes,
glands
yes,
out there.
yes.
That,
Yeah, they look
I
stretched.
don't want that.
No, no one wants that.
Yeah. So okay. So maybe stages is
You
the way
could. I mean,
forward.
I always say you address the thing that bothers you first, kind of. And you can, and if you want to be one and done, you can be. There's no like absolute must. It's really tailored and created for each individual person. And
Yeah.
I always say do the thing that really bothers you. Don't get talked into something else unless it's something that really you saw and you're like, you know what, maybe it's true. I'm having a big surgery. I'm going to do it all at the same time. One anesthesia, one recovery. I get that too.
I'm kind of thinking that, you know, especially if you have lots of kids and busy
Yes.
lifestyle, because
Yes.
the healing.
The healing,
takes time.
yes. Actually, I think the healing is the thing that people don't talk about enough. So now everybody's talking about facelifts and surgery because we have social media, super accessible, it's super accepted as well. And it's not like a faux pas anymore or like done under quiet, you know, behind closed doors. People embrace it. They say they've done it. They share their contacts, you know, so there's a lot more openness
I like
about it.
that.
I do too. I think that's
it's
how it should be.
refreshing that people are, you know, proud of what they've done and look at the outcome.
But I
it's
think
super nice.
I think also you should be very happy to be put your best foot forward. I mean, we all want to be confident at every age. Just because you're 50 doesn't mean you need to disappear and be invisible, or 60 or 70 or whatever age it is. It's about when people have surgery done, it's not for other people. It's for themselves. So then when they look at themselves in the mirror, they're like, you know what? I feel good.
Yeah.
And that's what it's all about. I don't exercise for my body for other people. I exercise because it makes me feel good.
Yeah.
And I want to still be able to wear the things that I want to wear.
Yeah, no, exactly. Yeah, and it's, I don't know, I
No
think
judgment.
exercise is super important for everyone. Mentally,
Exercise,
yeah.
sleep. Sleep
Yeah.
is another one. Hormones.
Yeah.
No, it is a lifestyle. Stress.
Yeah.
We
Does
can't
the hormone play in, obviously, a lot to your skin? Do you
I
see,
think so, yes.
you know, certain, the pre-menopause, etc., they need different treatments?
I think so. Well, so a lot of things, you start off very light when you're younger, and as you get older, you know, the armoire increases, and then at a certain point you're more of a surgical candidate. So you know, there's different stages, and then after surgery you actually have to maintain it. So you have to go back to, so it's taking you almost back a little bit, so that you can't just, you know, have the facelift and then you have to tune it. So you need to take care of it with the non-surgical things too, and good skincare and good lifestyle. You know, it's usually people, when they invest in that sort of procedure, they understand that it's a lifestyle choice, and they're more, you know, slathering on that skincare and the SPF, and, you know, they're coming in for their maintenance because they've invested that time and the money into feeling and looking their best, and they want it to last for as long as possible. But yes, absolutely. I think hormones, I personally, as a woman, I know that some of the doctors say, oh, you should have facelifts early on, you know, it's preventative. I don't believe in preventative surgery. I think you do it when something bothers you, because they're real procedures with real risks. And who cares if the risk is 1 in 100,000 if you're that one person? I mean, you know, if you get a palsy, a nerve palsy, and you say, oh my God, I didn't even have a, you know, like, I actually look good. Whereas if you had a complication happen and you were like, you know what, it really bothered me and I really wanted to do it, you'd still be unhappy, but at least there was a reason why you had the procedure done. So I don't believe in preventative surgery for anything. You know,
But if you have
have
early on, it will prevent you from looking older.
not necessarily. I think you have to do it when you have something. I think then it lasts longer, and then it also matches the rest of your body. But I do think for women, menopause is a very big and real situation, normal, you know, occurrence of life. And I think when you lose the hormones, even when you're replacing them with hormone replacement therapy, your skin quality does change. And you know, people say they hit a brick wall. I see it in my clinic all the time. You know, it's like, they're like, you know what, I felt like I looked good, and then all of a sudden I didn't. And I can feel that even for myself. I feel this shift from, you know, 49 to 51 was very big. And, you know, at 49 I felt I looked better too at 49, and it was a very big decline. And I hear that a lot. For some people it's at 46, some people it's at 55. Everybody, you know, has their sort of part. But I kind of think a facelift is good once you've hit menopause, because you don't want to have a facelift and then all of a sudden your hormones plummet, and then the quality of your skin is not as good, and you have more skin laxity, and then you've just had a procedure. You know, it's nice to, I think it's nice to do it when you're in menopause.
Yeah.
That's my personal opinion, but that is just my opinion. Everybody's got to do what's good.
Everyone now in the US, all of my friends in LA, they, you know, they don't drink anymore.
This is true.
They haven't been smoking, but all of that healthy lifestyle is in. You know, wellness is a
huge thing. Longevity. You want to live your best life. We're all living to 100, hopefully.
Yeah.
And we want to look good.
Yeah, exactly.
And feel good.
What would be your advice to yourself at the age of 21? You know, going back, looking.
Gosh, when you're young, you're so nervous. You don't know. You're also so green that the things you don't know, like that innocence is also a little bit of bliss. But I'd say just go with the flow a little bit, because, you know, the path you have is an accumulation of all the different steps you take. And, you know, what I'm doing now, maybe if I had stayed in the US, I would be on a totally different trajectory, and it would have been equally as good. But I think I would have said, you know what, you're exactly where you need to be. And, you know, do the thing that makes you happy or that inspires you, because you just never know where it might take you.
Yeah. Yeah.
I think you have to take a leap of faith sometimes, calculated leap of faith, but you just, you know, you never know. I think it's nice to just, in retrospect, it's like, oh, you know what, all of those things, they happened for a reason, even if I didn't know it at the time.
Yeah. And what about when you were doing your whole study and becoming a surgeon? Are you still in contact with the other surgeons you were studying?
Yes.
Yeah. So is there a big network?
So I have a big network, mainly of the ones in the US, because, you know, that's a very big bonding period. Gross anatomy, you know, the nights in the hospital, every other night on call, sleeping in, like, you know, not the best of conditions, and being woken at all hours of the night or not sleeping at all, studying for the crazy exams. So yes, I think going through that experience with certain people, you never break that bond. So yes, I'm in contact more so with the ones in America, because I didn't really go through the whole system here in the UK. Funny enough, most of them are plastic surgeons now. So it's interesting that even the ones that I studied with in medical school have gone on, you know, they're either plastics or orthopedics essentially, which is, I find quite interesting. So we were obviously all cut from the same cloth essentially.
Yeah. So someone there inspired you all to
be on
that.
It's true, you know, like that Operation Smile really did, it was a very pivotal moment in determining how I went on things. And then actually doing my fellowship here, just having that non-surgical aspect of it too, with products I didn't have in the US, again, I would never have such a strong or large non-surgical practice and that interest even if I hadn't been exposed to that in the fellowship that I had to do again because I had transferred here, you know. So that was a good thing that I did, even though it was frustrating. I didn't have a visa. It was, you know, I was going back from being in private practice to you know, being a fellow, working whatever hours I was given. So, you know, all of those things that seemed like I was taking a little step backwards actually gave me so much more in the, of course, a whole different aspect.
Journey.
Yes.
So she was a huge inspiration.
Yes, huge.
Yeah. And so to all the young, you know, girls, women that are right now in, you know, their journey of having to choose, what could you give them as advice to that really someone maybe have said to you, or that process that could just help them a bit?
Well, I have a lot of friends now who want to have not a second career, but like their kids are getting a bit older. And I have a lot of young people who come and shadow me. And I think, you know, the young people, I always say, someone did give me this piece of advice when I was starting out my private practice in DC. And everyone told me it's super saturated, don't do it. You're never gonna get busy and you should just move somewhere else. And I remember my mentor, he told me.
That was the advice?
That was advice. Like people are like, that's gonna fail. Like they were saying, you're setting yourself. I know, it's super, no. But my mentor, he said, you know, Maryam, there's always room for one more. So if this is where you wanna be, maybe it's gonna take you a year or two to get where you wanna be, but you'll make it happen anywhere. So, you know, don't listen to the noise. And he was right. So I feel like people get scared. Is there enough, you know, there's so many of this, or am I good enough? If you want it, you can have it. You just have to think sometimes outside of the box to get to where you want to get to be. And for the older people who might want to change, I always say there's always time to reinvent yourself, and don't be self-conscious, because I think sometimes, especially when you go later on in life, you know, your body's changing, your relationship with your kids and your family life is changing, those dynamics are changing. And then sometimes women, you know, there's all the young, beautiful young people. Youth is very beautiful. And as you get older, there's a wisdom that comes, but sometimes women, I hear, they feel like they're a little bit more invisible. And you just have to shine bright, because you're not invisible, and you can do a lot of good. And you see a lot of women in their 50s and 60s doing great things too. So I just think, you know, if you want to do it, you should just do it.
Yeah.
Like you said it, just do it.
Take some challenges.
Just do it.
Yeah. Yeah, I agree with that.
Find some people who you admire, and, you know, like, you do so many different things. We were just talking about it beforehand. You know, find some people who inspire you, and, you know, hold on to the good and the sunshine. Make your tribe. Women are the best supporters when they come together to help one another. And, you know, it does help to have a good partner. I'm lucky. My husband is incredibly supportive of what I do, and also my family. But really, ultimately, if you want to do it, you can do it at any age.
Yeah. So has your husband been a testing animal? Has he had his eyes?
No, I want to do him. He won't do it. Actually, last night we were talking about it at dinner, and he's like, you know, I don't want surgery. And I was like, just a little bit.
I love that.
No surgery for him.
Freaking out when he goes to sleep every night.
I know. Sometimes I'm like, I'm just going to inject you when you're sleeping.
Exactly. Right. So what keeps you, you know, driven and keep pushing yourself, and, you know, coming up with new products and the research and you know, educating that to your clients?
So that I love. I don't know, I just love it. I feel like it's problem solving. So that motivation is the curiosity to do better. I feel like I'm always curious. I never wake up thinking, oh my God, I have to go to work. I'm always excited to go to work. I love my patients. I love hearing what their concerns are. And as an aging woman too, I am the demographic that I want to treat. So I'm always curious on how to make things better. I think that's, I find it fun. The doctor side is just so, it is fun. It's just really nice. It's those connections I have with people and just trying to do better. The skincare is a little bit harder, because every day there are different hurdles that come my way.
Yeah.
And, you know, I never know
What do you mean hurdles?
You know, there's tariffs in the United States. There's a war between Russia and Ukraine, and, you know, both of them love MZ skin products. Can't sell to Russia anymore. Will the Ukrainians buy? They're being bombed. I mean, it's like, you know, China, the situation in China changes, you know, cross-border shopping has changed. You know, there's so many different things that you get hit with. You know, your contract manufacturer, they're going insolvent. You know, like the packaging you ordered 9 months ago is 3 weeks delayed. You know, there's always something that comes up, you know. Someone doesn't like how someone else spoke to them. I mean, like, it could be anything. Yeah. So there's a lot of unknowns, and so it's always, I'm always putting out little fires. I think I've gotten pretty good at being quick, which is important. But that's I think probably the biggest challenge in the business world is, you know, the problem solving, because there's always a solution. It's just, you know, sometimes you just can't see it. And I always tell my team, I always, you know, try to set them up for success. And I say, if you can't find a solution, talk to us, because maybe we'll think about it in a different way, and we'll come up with a different way of looking at it. Or, you know, we have fresh eyes, and maybe we come up with it.
That's how it works as a teamwork.
Absolutely.
You know, everyone coming together. And
no one can work. No one can work in silo. I like the team. I hope more people come back to work, like, in the office, because I think there's a lot to be said about that environment.
Yeah, absolutely. And then AI. I mean, it's such a massive topic. Like, how is that going to
impact everything? Yeah. Well, I think medicine is going to be very personalized. I think there's going to be huge benefits. There's going to be pitfalls too, because you can't have it unchecked. And also, just like Google Doctor, you know, to somebody who's untrained, you can get wrong information. It's just an algorithm that puts together a bunch of things based on what it gathers from the internet too. So if you don't ask the right questions in the right way, and you still need to be able to fact check. But I think like skincare is going to be much more prescriptive, and I think that's amazing. I think medicine is also going to be much more prescriptive because we're going to come up with different ways of evaluating. And also for my business, it's different. You know, like we had to have these crazy photo shoots, but now you can have AI do so much at a much more cost-efficient way.
Yeah.
It's not creative. You still need the creative, but to be able to do that means that you can be a little bit more efficient and more playful. The hard part is you don't know what's real and what's not anymore. And that blurry line, I find that difficult because I also think people use it to make fake content and, you know, fake results for surgery, for instance, or even clinical trials. You know, like the bodies that police that are not strong enough to be able to really see every problem or issue. And people, there's a lot of fake and false advertising.
And what about, I mean, there's all these new films out, you know, where the robots are taking over the operations and
So we already have a lot of robotic surgeries for certain things.
Like what?
For abdominal surgeries.
Right.
There's even some things with the brain, you know, that they're starting with, but for precision, it's great in terms of like movement of the hand, and some things. But I think you still need the doctor there. I mean, I don't.
I'm not sure I would go ahead.
No,
if that was my only way to get my facelift.
No, I wouldn't do a
Not doing
facelift
it.
like that. Because I do think that, first of all, there's always anomalies. They say the algorithms are going to be so good that they're going to be able to sort of think through the anomalies. So if something comes up, they've already have, you know, the data in there to know what to do in that event. But we're not there yet, so definitely not there.
Okay. All right. So
Not for now. We can park that for now.
Okay. Thank
Please.
you. Thank God. Okay. So, last question.
Yes.
What is your go-to within fashion, within the item that you know you love wearing when you go to work and you have to see your patients? I mean, obviously you're wearing.
I'm wearing a white coat most of the time, and actually I'm never in black, but today I am for some reason.
But
I think
it goes
because I was
really
so
well
cool.
with the suit, so thank you.
But I live in color, and so I love being in color. And I love a little jewelry. I mean, even if it's something small, like I always have like little earrings on or like a necklace, and I don't know, I feel like that's my personality, you know, different little things. I feel sort of naked if I leave the house dressed without something on.
Okay. And are you adventurous? Would you see yourself as adventurous?
I think so. I don't know if everybody else would, but I do.
Okay. So, you know, the whole thing of driven women.
Yes.
It's all about women coming together who are
I love
driven.
that, yes.
And when you hear driven women, what comes to your mind?
I think of like a fabulous, sexy, out there, you know, living her best life woman. I know some people may think of it, oh, she's so driven. I think of it, oh my God, she's so driven. And I love it. It's energy. I feel like when I think of a driven woman, I think of energy, and I think that anything is possible because I think women generally are problem solvers, and they have always had to juggle their life, their kids, their work, their social, their spouses. And so they're always trying to figure it out. And so I feel like it's a dynamic, amazing person with just energy.
Fantastic. Well, thank you.
Thank
so
you
much.
so
I know that you have to go to basically
I do.
school parents
Yes, I
meeting,
do.
So thank you so much.
Thank you. I hope you enjoy the products
Oh, I'm
too.
so excited.
That was so fun. Thank you so much.